for 2 years now. Right now I work at Davis Hospital, medical center in their ER, and I absolutely love it. I'm learning a lot, seeing a lot, and just loving being a nurse. So I want to talk to you today about fall prevention. Leisha and I came a couple weeks ago and we surveyed some of you just to find out what you wanted to learn more about, and fall prevention was one thing that popped up. So to get started here, according to the U.S. Preventative Services Task Force, in 2012, falls were the leading cause of morbidity and mortality for people older than 65 years of age. And 30 to 40% of people 65 years of age or older fall at least once a year. In addition, falls rank as the 7th leading cause of unintentional injury fatality among older adults, and the most common cause of non-fatal injuries in hospital admissions for trauma. These statistics are extremely significant. Thus, it's really key that we start to prevent falls in hospitals, in nursing homes, and in the community, which is why we're here today. So, what can be done to reduce the risk of falls for you guys without taking away your independence?
Go ahead.
First, the U.S. Preventative Services Task Force recommends exercise or physical activity, as well as vitamin D supplementation to prevent falls in community-dwelling older adults. So those are two really easy things that you can do to start reducing your risk for falls today. If you're not already taking a vitamin D supplement, you can do that. It helps strengthen your bones. And exercise. When we're talking about exercise, we don't mean you guys need to run a marathon. Even simply going outside. It looks like my batteries run out. So I'm just going to talk louder. So even just a simple walk around the block would be really beneficial. That weight-bearing exercise is crucial. It helps strengthen your bones. Good cardio for you, and it can even help reduce depression or just help improve your mood. Second, you should review your medications with your primary care physician. It's been said that
Has anyone said
that a risk for fall increases if you're taking over 4 medications. So if you can cut down medications that aren't necessary, that would help decrease the risk of fall. Medication with dangerous side effects such as drowsiness, mental confusion, problems with balance, loss of urinary control, or drops in blood pressure, those are all things that could cause a fall. Third, we've passed out some handouts for you, and I'm just going to go over them quickly. So I've got on the handout, I've got some problems you might encounter at home, and then an intervention of what you can do to help fix the problem. So in your house, if you've noticed that you don't have enough light, it's recommended, especially by your bed, that you have a bedside lamp or a night light. And you can also attach a walker or a flashlight to your walker or cane. Turn the batteries. Thank you. It's okay. Yeah, so just make sure you've got enough light all over for you. If you have rugs, this one's really important. If you have rugs that slide around, if you can, just get rid of them. But if not, you can tack them down. Hello. Thank you. So if you have sliding rugs, it's best to just remove them completely, but if you want to keep your rugs, tack them down, use rugs that have a rubber back, or even use the 2-sided tape to just secure those rugs so that you're not at risk of falling. If you have a slippery floor, make sure you have non-skid shoes or rubber-sole footwear. It's really important. And you can even use non-skid wax or an indoor-outdoor carpet. If you have a thick rug edge in a door sill, you can put a metal strip down so that it makes that transition from one room to the other easier. You
You can also remove the door sill or just